Hello and Assalamu alaikum, everyone. Welcome to another COVID series show, my Facebook Live, which I've been doing for quite some time. In the last 3 weeks, my schedule was quite busy, so wasn't able to come to the Facebook. But luckily, I managed to get hold of one of my very dear colleague, very experienced colleague, and very, what should I say? I think need to give your portfolio, such a big portfolio, Shabina. Mashallah. So Dr. Shabina Asad Qayyum is there with me today. And obviously, I'm really thankful that you have accepted my invite and obviously attending today Facebook Live. Shabina is a GP in city of Petersburg. She has got an extensive background of, various or, almost all the medical specialities, particularly in emergency medicine. And you can see, mashallah, she's very pretty as well. So that shows that she's got a special interest in dermatology and skin and mental health as well. Shabina is also a co-host in one of the local community radio health show on Salam Radio in Petersburg. She is also a member of British Islamic Medical Association and has delivered several talks on health associated matters. And most importantly, she is an elected councillor for Eastward in Petersburg. So thank you much and welcome, Shabina.
It's an absolute pleasure. And honestly, you have over-justified my accolades. Thank you so much. And it's such an honor to be here. And I've been watching your shows thoroughly. And I'd really like to congratulate you on this education that you are imparting to the communities, both here in England and in Pakistan as well. You're certainly somebody that I feel very proud to call a colleague. And your contribution to the medical profession absolutely speaks for itself, Salman. So I'm very grateful to you for having me on board. Thank you.
Thank you, Shabina. It's my honor, obviously, to have these kind words from you. We'll come back to the topic straight away, Shabina. As I think we were discussing earlier on, we are approaching towards second Eid of the year. And last time we did see there was a big spike in the numbers, particularly in the Asian and Muslim community. Not only in UK, but in Pakistan as well, because I don't think people followed the SOPs properly in the last, 10 days of Eid, Ramadan and during the Eid time. And later on, obviously, we did see a big spike. So the idea was just to reiterate, all the updated guidelines, what we have learned in the last couple of months and what all these people should be practicing during the Eid time, particularly when it's the Bakra Eid, people would be going around buying the animals in Pakistan. Here, obviously, we expect that it's coming over the weekend, so people will go out and see people as well. So the guidelines have changed as well, what I remember and what I gather. And obviously, it would be good to know from you that what are your suggestions in this regard based on the current evidence.
So you're absolutely right, reiterating from the offset that none of us is immune to developing this virus. It's a very new virus. It entered within Europe and within the United Kingdom at the beginning of February. The WHO declared it a pandemic around about that time as well. And we had lockdown precautions that were implemented on the 23rd of March. Thereafter, we have seen an exponential rise of cases. And if it counts for anything, all of our Muslim brothers and sisters who are listening to this might like to know that the current case rate or infection rate or the number within the United Kingdom is 299,000 as of yesterday evening, with a death rate of more than 45,000, which is very, very high indeed. Now, Salman, you very rightly say about the fact that we are a particular at-risk group, and it's not just because of our social infrastructure. It is because of the fact that we are predisposed to certain comorbidities, or in other words, in easy language, those conditions that a lot of the Caucasian population don't have. So we've got a lot of chronic illness that revolves within our communities, such as diabetes, heart disease, which you very nicely stressed on in your previous programs as well. And the fact that alongside that, there is no quick fix to these conditions. However, they do predispose us from a genetic perspective as well. to developing COVID-19. So we are categorized as a vulnerable community in that regard. Now, from a social perspective, we have a lot of social setups that are culturally the norm for us. We like to partake in our Eid celebrations or in Jummah prayers. I think that the Muslim Council of not Peterborough, but the Muslim Council of Britain has set out and stipulated conditions and guidances for us to follow. But it all boils down to the fact as to what has been stipulated by Public Health England. And the guidance can be extremely difficult to be abreast with, simply because of the fact that it is updated on a daily basis. Initially, we saw guidances changing from the lockdown on a weekly basis, and now it is updated on a daily basis, and it can certainly be very hard to keep up with. Now, part of our communities, those that aren't very well familiar with language. We have language barriers, we have communication barriers, we have those people that aren't very computer illiterate. That's where shows and meetings like this come in to try and educate the population. So it's very important that running up to Eid, we make sure that people are aware of the social distancing guidance. And like you say, from the 25th of July, sports facilities and venues, including indoor gyms, fitness, and other dance studios, indoor swimming pools, and indoor water parks can open. They haven't mentioned anywhere over here yet that mosques can open. However, in previous guidance, it was stipulated that mosques can open with regulations, with adequate risk assessments in place, and taking social distancing precautions. Now, I'm not sure what the state of the mosques are throughout the country. However, in Peterborough, we do have a joint mosque council with some absolutely wonderful mosque personnel and chairpersons who are very, very clear about the guidance. And they have been praised, in fact, by the local authority for implementing those social distance guidancing. So we have four main mosques within Peterborough who cater for all sects of Islam. And they have kept a limit up until all of the Friday prayers, all of the Jummahs that have been executed. They have made very clear through communication on social media, on Facebook, for example, and through signage and posting on their gates as to the number of people that will be allowed in the congregation. They have illustrated the social distancing measures within the prayer halls. So there's been measures implemented where they have put down areas between worshippers that meet the social distancing guidance. They are taking temperatures of the worshippers, and they have stressed that the worshippers should make wuzu at home, and they put their shoes in a bag, they should have their hands sanitized, etc. So there are lots of things that they have put in place, and this guidance has all been taken from Public Health England. We can only be praiseworthy of our local mosques here. Now, it might be different in different areas of the United Kingdom, but I think the message to get out over here is that this is an extremely contagious virus. It's an extremely contagious virus, the nature of which we are not aware of 100%. It is still being researched. We do not have a vaccine. And on top of that, we are a vulnerable community who is at risk of developing this. Therefore, it remains to be seen what the arrangements will be on Eid-ul-Azha. And in answer to your question, last but not least, please do await the guidance that is being given by your local mosques. It's the first time we've been faced with a global pandemic. Nobody knows how to deal with it. However, the best we can do is to help ourselves and help our communities by following the guidance that has been given by these religious institutions that no doubt will be available in the week running up to Eid.
To be honest, it's very good, and I think you've summarized everything very nicely, Shabina. And I would like to say the same thing to the Pakistan and other Muslim country audience who are actually watching us at the moment, that these are the basic principles that we all can follow anyways, whether you're living in Pakistan, India, Dubai, wherever it is. So if you're going for the mosque congregation, you can do the wudu at home. When you go there, make sure there is a safe distance maintained all the time. Make sure that your prayer mats are there with you, and obviously you use those prayer mats. And even once you come back home, make sure obviously you wash your hands. And in fact, when you're going to the mosque, make sure you wear the mask. So I think these are the basic principles until we get the vaccine or until we know what the cure is for this problem. Then I think we must follow these preventive measures. And I think this is the way we can actually control the disease. This is the best way. And tell me, last time, obviously, it's important. I would like to ask you, Shabina, that we did figure out that the numbers went up, and particularly being the Asian community, we are at risk of getting the severe illness anyways due to COVID. So what would you suggest for the house gatherings at the moment, which we are going to expect, although the government has eased up the lockdown kind of thing? We can still obviously meet up, and small gatherings can happen after 25th of July in UK. So whether it's in Pakistan or whether they are in UK or anywhere else, what would be the general principle, general guidelines that you would like to suggest?
So I'd like to use the analogy of the guidance that Public Health England has stipulated from the 1st of August. And what they have said is that small wedding receptions, sit-down meals for no more than 30 people can take place, subject to COVID-19 secure guidance. Now, we all know prior to that Eid-ul-Azha is going to be taking place before the 1st of August, which otherwise means that no sit-down meals for 30 people, up to 30 people, can take place. So the guidance is quite clear. However, the guidance has not stipulated gatherings within religious institutions, within households, therefore putting in mind all of the risk factors that we are subjected to as a community. It is within the best interest of our communities and of ourselves not to partake in any gatherings, and also to observe social distancing, just as we did in Eid al-Fitr. It's going to be very difficult, but the more stringent we are in observing this guidance, the quicker we will come out of this, and the better we will be able to have celebrations and observe them throughout the year. It is a very sad state of affairs, and this is something, Salman, that I really do hope sits with a lot of our people listening today, that do remember on the 23rd of March, there were 45,000 people that were aware that we were going into a lockdown situation and are not with us today. And a significant proportion of those 45,000 people who have lost their lives to COVID-19 on the 23rd of March did not know that they would not see the end of this year. So a lot of us here have lost loved ones. In the medical profession, we have lost friends. Please be kind and considerate, first of all, to yourselves and your families in the way of protection, and also to your community as well.
Shabina, tell me that people, a few of the questions I received, they said that is it possibility, there any possibility that this virus can spread through animals? Have you read any article or any knowledge? Because obviously, particularly in Pakistan, here we don't see obviously live animals, there's no direct interaction with the human. But in Pakistan and India and all those Asian countries where they sacrifice animals, it's very, very common that children would be playing with these animals, and obviously they'll be going down to all the markets to buy and purchase these animals. So is there any, can you get the infection while engaging with these animals?
Well, there is no concrete evidence to substantiate that there is any animal to human transmission. There have been articles that have been published that have stipulated that perhaps cats and dogs can carry the virus in the dormant state, but not in the infective state, which brings to mind about the fact that you could possibly contract it. However, until we have evidence for it, I wouldn't go running into an area or an arena where there are live cats and dogs, because not to forget that these animals have been handled by human beings, the infective status of which we are not aware of. So my advice is that please refrain from going into an area that could breach social distancing, where you know that the state of health of these animals could be jeopardized by being handled by an individual that could be exposed to the virus beforehand, and therefore that increases your risk. And if you've got any underlying medical problems, you should be even more careful.
Definitely. Yeah, this is what I said to one of my colleagues. I was speaking to them yesterday, and they asked me this question. I said, I'm going to address it today. But I think there was a guy who was working in zoo. I think I was reading a literature, and he got infected with COVID. And later on, they tested the tiger he was looking after in US. I think that was in New York, and the tiger was found to be positive. But obviously, the animal didn't have any disease. So this is very important for those people who are going to market to purchase these animals. They must take extra precautions if you're going there. If you have to go, make sure the distance is maintained. Make sure you're wearing the mask. Make sure you're wearing the gloves. And when you come back home, obviously take proper shower and try to maintain all the basic distance. I know practicality is very important. It's easy for us to say the guidance. When it comes to the to real time, carrying out all these things, sometimes it becomes difficult. But subconsciously, if you have got all these guidelines and what we are suggesting in your mind, I think that would be helpful. That if you're going to, because hugging is very common during the Eid time, we are seeing each other. So obviously, make sure in your mind that you are keeping the safe distance. Try to not to obviously shake hands. And if you have to, then make sure that everyone should have the hand sanitizer and they should wash their hands. So I think the basics at the moment, we have to stick to them, and until we get the solution to the problem. Okay, that's very good. A few obviously people have said salam and hello. So I can see that. So quite a few messages have come up. All right. So coming back to that, so what should be the next stage, Shabina? What do you think? Are we expecting vaccine pretty much soon, or what would be how do you foresee in the next couple of months things would be? Because we are approaching after Eid, this is a proper summertime. People will be going out. So what would be your suggestion and guidance, those who want to enjoy sun in Spanish Islands?
Well, we've already had announced yesterday, the government announced last night from Spain that anybody that's returning from Spain needs to be quarantined for 14 days. Now, I don't wish to draw politics into this, but I do think that we knew fair well during the lockdown and when this was initiated, we knew fair well, if we take examples from countries that have lower infection rates, for example, South Korea, for example, Germany, for example, New Zealand, that they had stringent measures in place to prevent the increase of their infection rates. So one of them was quarantining people upon arrival within the United Kingdom. We've never really implemented that measure since the lockdown. And there are people that have livelihoods attached. We have to remember that those individuals here living within the United Kingdom have a life outside COVID-19. There are many professionals who may be on furlough or who are on frontline, such as yourself and myself, working. And for these things to come into place, such as announcing quarantine, it may be a justified measure, but it is too little too late. And it's the same with the mask legacy as well. So we have been asked to wear masks to prevent the spread and transmission because lockdown has eased. However, the World Health Organization stipulated this guidance very early on in the year. And we have seen that wearing of masks alongside things like mass testing has proven very low infection rates in countries such as South Korea, where significant studies have taken place, and also in Germany. So life has certainly changed after COVID-19, Salman. We know that very well. Life is never going to be the same. There are going to be different ways of working. Our children will be treated differently in school. And it's really interesting you should say that, because one of my dear colleagues, who's also a GP, feels, and she said this to me, articulated this to me, that she feels that the world will never be the same again after COVID-19. And to a degree, she's absolutely right. And I think that when we're looking locally as what people should expect is that everybody within the United Kingdom is really much at the mercy of what the government has stipulated. They do have a SAGE committee that is advising them accordingly. However, I do feel that strict, stringent policies should have been implemented sooner rather than later. And yes, better late than never, I would say. However, we could have saved the numbers and masses of people that, number one, becoming infected, and number one, have lost their lives as a result of this disease. So life will definitely be more different. And I say to people, always err on the side of caution, always be prepared for any changes, etc. And if you are working, like we've come back from Spain, those people that will be coming back from Spain, do make sure that you gain advice from your employers about going back into work, and that you have supportive employers as well that enable you to undertake. Well, they will have to, by law, they will have to accommodate you.
There would be an effect on the hospitality industry as well, because quite a few people are actually arguing on the fact that, you can't, like, yes, one angle obviously is the virus itself. Obviously, we are trying to make sure that all the precautionary measures are in place. But if you don't travel, if the airlines are being affected, if people actually who work in that industry is being affected, then we are expecting the recessions and poverty, and there would be a big number of people and mass population we are talking about in the next couple of years that would be affected for that. So one of the rationale is obviously to have a balanced approach and do that. So obviously, we being the doctors, we're trying to make sure that we are actually sticking to the guidelines and we give the best possible medical advice. But what's your views on those in these angles, which, to be honest, I felt is right in pointing that side, which obviously I don't think we look that much in journal discussion, that financially, obviously, these people would be affected. And later on, obviously, at the end of the year, if they lose their job, and obviously we expected a big recession, what would happen? That how you can mitigate that risk?
That is such an important question. Now, no doubt, the economic effect that we are seeing at the moment is just the tip of the iceberg, Salman. I have been assigned the new shadow cabinet portfolio here within Peterborough City Council for investment and commercial interest. Being a doctor, it sounds like a very different combination.
Well, that's why I asked you this question. I think I was just trying to cover that part of your portfolio.
Yeah, well, it's surprising because I've been around local businesses, and what we are doing here within Peterborough is to promote local businesses. Your local businesses are the ones that have worked extremely hard, have taken a big financial hit as compared to the larger national retailers. They are the ones that have put in a significant amount of investment. So for those people that are able to go out and about within their town centres, within their shopping malls, please do, within reasonable social distancing guidance, support your local businesses. They've put in an awful lot of investment, and this is how we can locally try and help them financially. However, like I say, this is the tip of the iceberg. And although we couldn't have completely have avoided an economical crash, I think that our priorities have been focused elsewhere in the economy. So, for example, stamp duty is being given to homeowners. My thoughts are that if that revenue had been regenerated and refocused and rechannelized to business owners, we would have seen a significant salvage in the economy. The Bank of England has predicted that we should hopefully survive this. And nobody, let's face it, whether we're in opposition or in government, nobody wants the economic stability of a country to fall. We don't want that. But I think we have to get our priorities right. And one of them is supporting businesses within the right way. Yes, buying homes contributes towards the economy, but also supporting your local business, which contributes to nearly 70% of the revenue that this country generates, is also not a bad idea. So there will be lots of companies, once hopefully lockdown is eased, that will be suffering the financial repercussions of COVID-19. Whether we can salvage that or not is yet remain to be seen. However, it is very important that what we can do as the public is to support these local businesses as well, and encourage buying from your local businesses. And for business owners, what I would suggest is have a look at other innovative ideas of trying to promote your business. So social media is now in use. Do you have an online website? Do you provide deliveries at home rather than encouraging people to come through your door? So these are some of the way that I have seen businesses improve and try and salvage their own economic recovery as well.
Yeah. No, thank you very much, Shabina. I think it's a very comprehensive answer. Quite a few other messages have come up. Well, Assalamu alaikum, Sawa, Assalamu alaikum, Moon. Qazi Fazal Alam has asked about low vitamin D and intensity and complications of COVID. I think there is a correlation they have found, and I think Public Health England does recommend having vitamin D,
Yeah,
on daily basis,
absolutely.
like 10 microgram or something like that, what I remember.
That's right. Now, Salman, first of all, I'd like to thank Qazi Saab for posing this question forward. Vitamin D is not just a vitamin. The relevance of vitamin D is phenomenal within the human body. It's actually considered a hormone because it acts on every single cell of the body.
Yeah.
Coming from Black and ethnic minority groups, what places us at risk. There are studies that have substantiated our increased risk because of a lack of vitamin D. And what it actually does is, those studies have now shown that inadequate sources or inadequate levels of vitamin D hinder our ability to fight infection. Now, the World Health Organization has stipulated that up to about 800 international units would suffice if we were to take a supplement daily. There are some over-the-counter supplements that you can get, for example, Stexerol, but for ethnic minority individuals, it is advised that at least 1,000 international units daily would suffice. So yes, there is a link.
Okay. What about zinc and any other antioxidants, and diet-wise, would you recommend anything to the people? Do you think it makes any difference having vitamin C or any multivitamin in your practice? What's your views on it?
So I gave a talk about natural sources of fighting the immunity system or boosting your immunity system when fighting COVID-19. And in that talk, I mentioned the fact that having vitamin C as a daily source helps boost your natural immunity and also aids in the absorption of many other components within the diet, for example, iron, etc. So we know that there are a lot of women who are within menstruating age who are at risk of developing iron deficiency anemia, and having an underlying vitamin C deficiency doesn't help them with regards to contracting infections. So vitamin C, a daily dose of that is definitely recommended. And zinc is actually an anti-infectious mineral. The problem with zinc, though, however, is that its dietary source isn't very well documented. And it's the same with a mineral known as biotin too. So biotin, selenium, and zinc are all very good sources for fighting infections. And they can be most commonly found within oily fish or within nuts, within pulses, etc. However, it is also recommended that if you can get your magnesium levels tested and your zinc levels tested, if you're found to be deficient, it's probably because of a dietary source, and the dietary sources of zinc aren't that brilliant. We tend to cook a lot of our foods, and because we cook a lot of our foods, we lose the valuable zinc and magnesium and the minerals that are needed. Therefore, it is suggested that you have nuts and have pulses in their raw form so that you can gain the zinc that is needed to help you fight the infection.
People say that as well, Shabina, that the food that we eat nowadays is not organic, so it's being grown artificially and very quickly, so they don't get that much time to absorb nutrients out from the soil. And that might be the reason we may be eating all these fruits and vegetables, and our diet might be healthy, but still we may be deficient in these vitamins, which in some way it sounds reasonable as well. Yes, because everything is so commercially grown that there's a possibility that all the chickens can't be of same size when you go to all these stores. It's definitely being grown in such a way, so you may expect there would be some nutritional deficiencies. What do you think about that?
I do think that that is the case. So I became hypothyroid after the birth of our fourth child in 2011. And I realized that actually my sources of iodine within the diet weren't very good. And I did some research on it, and I was found that farming soils here within the United Kingdom are deplete of iodine. And instead, the fertilizer that is used contains a molecule known as boric acid, which has exactly the same molecular weight as iodine. So when you ingest foods that are supposed to have a content of iodine, they have boric acid, which then attaches itself to your thyroid receptors and prevents the absorption of thyroid from other sources, which is why 1 in every 11 persons within the United Kingdom is hypothyroid. So I started to increase my intake of natural iodine through organic vegetables. But it's so interesting that you should say that, Salman, because I gave a talk to a population from Azad Kashmir. And whilst I was speaking away and talking about how having organic is very important, etc., somebody asked me a really important question, and that was about affordability. Within this country, we promote far too much in the way of fast food outlets. We have a growing number of fast food chains. The nutritional value of those foods that are being sold is very, very poor. In fact, it's detrimental to health. And if you look at the organic produce on the shelves of the supermarket, the prices are exorbitantly high as compared to the other commercially grown fruit and vegetables. And it's the same within Pakistan as well. People generally, the ones that live in poverty, really don't have a hope in trying to address the deficiencies that they have because they cannot afford to buy healthy food. And I think that we definitely need an overhaul of how we are promoting health and how we are promoting a healthy diet. And Boris Johnson has recently announced a couple of million to billion pounds to cut obesity. And I really hope that this is part of that pledge to try and cut obesity, because certainly promoting out healthy eating and decreasing the prices of healthy organic vegetables will contribute to that cause.
I think this is a very important point for all the listeners as well, that obesity put you at very high risk of getting COVID and the severity of the illness as well. So if you're obese, if you're overweight, you must try to lose some weight. The problem during these 3-4 months that most of the people were, obviously we all were under lockdown, we couldn't go out, we couldn't go to gym, we couldn't go for exercise. And the comfort eating was one of the principles. Even I didn't want to lose weight. I'm usually very cautious, and I have gained about 4 kg. I don't know where did it come from. Might be because of the because it didn't have anything to do. So you just start snacking yourself, and then later on you realize you have gained some weight. So it's very difficult to shed that. And I think subconsciously everyone would have done it. So if we all check our weights, it would be it would definitely be 2 or 3 pounds above what you would have expected. So it's very, very important now to nip it in the bud. Make sure that once things have started to ease up, so we must go out, do the exercise, keeping all the safe distances, and obviously diet is one of the source as well. Okay, I think we've covered quite a few stuff, Shabina. So we'll just summarize those who actually are listening at the end that Eid is approaching. So in advance, Eid Mubarak to all of you. But it is very, very important that we must follow all the precautionary measures. If you're going to the mosque, make sure that the safe distance is there. Wear the mask, wear the gloves, keep your repair mats with you when you come back home. Make sure you wash your hands. Make sure there's a safe distance when you handle the animals. At home, if people are visiting you, make sure obviously you do not hug them. Keep the safe distance. And I think these are the basic principles we all must follow during the COVID times when we don't know what is, how to manage and how to manage this disease until we get the proper treatment, because there is no vaccine is available. I think we have covered all the spec. Anything you want to say as last words, Shabina?
Yes, thank you so much, first of all, for this opportunity. I think that it's a great platform for spreading pertinent messages to the community, and also the fact that we really do hope that you can observe your Eid. It might not be quite the same as any other Eid that we've celebrated in the past, but just one thing I'd like to add, that if you do develop any signs of a temperature or a cough or any shortness of breath, please do not attend the congregational prayers, and save yourself and save those around you as well.
Thank you very much. I think it's an excellent message. Thank you once again, Shabina, and Eid Mubarak to you. Obviously, I'll be bringing you on Eid Day as well, and everyone take care of themselves. Okay, thank you. Okay.
Thank you. Thanks for the opportunity. Assalamu alaikum. Assalamu alaikum, everyone. Eid Mubarak.